Hey guys, it's Dr. Danny Shaban with Dominion Women's Health, our podcast number 62-443. And today I'm lucky to have two guests on the podcast for Dominion Women's Health, is Sophia and Angelina, some of our nursing staff in our practice. And we're going to take on a topic that people have sent us messages, have called in asking for us to do this podcast, and I've refused. So today I finally said yes because I didn't have another topic to talk about, to be honest with you. So we're going to talk about abortion. And we're going to take two different views for abortion. And we're going to have the one extreme and the other extreme.
I'm not extreme.
And I'm going to let you guess who's who. But just like a quick overview, I'm going to have Sophia just tell me what she thinks and Angelina, but I was trying to look up some information about abortions in the United States and in the world. And I found something that was amazing. Like when you think about abortion rights and all this, you think about Roe v. Wade, you think about in the 1970s, what was it, like 73, when abortion was legalized in the United States. Already in 1973, for people to understand, there were states that legalized abortions. But in 73, the Supreme Court ruled that it was completely legal, and it was a case. It wasn't saying specifics on abortion. And that's when it opened up in 1973. But the crazy, crazy part is abortions have been going on for hundreds of years. And when I was looking up like abortion, like when did it start? And when did it become a huge issue in this world? It was in 1847. 1847. And guess who started in 1847 against abortions? It wasn't the Catholic Church, like some people were thinking, okay? It wasn't like left-wing extremist or right-wing extremist, like some people were thinking. The crazy part is, it was the AMA, the American Medical Association. It was at that point just forming, and it didn't have credibility and clout. So they needed a platform. And I was reading about this, and they took on abortion because abortion was being performed all over the world. It was being done. But these, I want to say bastards, but they're not bastards. We need to watch what we say on this podcast. But what they did is they took it on because it wasn't physicians doing the abortions. It was midwifery and women that would go to your house and do it, that were trained at using like herbal supplements. I mean, I even read one thing that was crazy. They would take a tampon and soak it with an herb that would cause women to miscarry and abort. They were doing herbal inserts into the vagina. And then the midwives were also trained to do D&Cs, which is the way of abortions that are performed in the United States, the majority of abortions right now. So the AMA wanted to take a stand for physician groups. So that's how the anti-abortion started, which I would have never guessed it. Would you?
Did they take the stand of like, this is a life? Was that their
their
argument, or did they say like, oh, it's
initially
unsafe?
Of saying that these were non-physician trained, they shouldn't be doing it. And then they jumped on, this is a life. And they took the approach of, this is a life at conception, which is totally hypocritical of them, because over the years, they've changed their opinion back and forth. Watch me get some emails in regards to this. But yeah,
100%.
I was like blown away by that. And I wrote like a couple little notes in regards to it. It was crazy. And some of the other stuff, like in 64 and 1965, Norway had gone ahead and approved abortions. In 1965, when we were looking at abortions in the United States, 17% of maternal mortality, that's women who died in pregnancy, 17% of them were due to abortions. And that's the crazy part, because they weren't being done properly. They were being done by like these clinics that were underground and all that. So as much as people want to hate Roe v. Wade, I mean, the good thing about it is we legalized abortions. So for women that were getting a legal abortion, it was being done properly under the right situations. So, and then I was looking at some of the other stuff, like other countries, how they feel about abortions, because you know how the United States is extreme one way or another. But if you look at Japan, you know, abortions are legalized in Japan. Any woman can have an abortion. You have to say, and I was reading some of the requirements. It has to be like if your life is in danger, the baby has like risk factors or malformations. And then the one fine print says for financial reasons. So we took to that. But you're not allowed to, what I've read so far is you're not allowed to have one if you're over 14 weeks pregnant. So that's one thing. And then if you look at Spain, you know, I just messed it up. Spain is 14 weeks. Japan is 22 weeks.
Dang.
So, but the majority of the world uses 22 weeks to 24 weeks as a cutoff. In the United States, we were using 24 weeks as a cutoff. Some states were trying to push that, and some politicians were trying to push all the way to delivery that you could abort. And we'll get into that in a little bit. So now that I can shut up and we can hear each one of the lovely young ladies' opinions. So how do you feel about abortion, Sophia?
Personally, I'm pro-choice.
And when you say pro-choice, are you pro-choice as in a woman has a right to choose, or a woman has a right to choose any time of the day she wants, the time of month she wants, or I mean, I always hear this pro-choice, and then when people look at me and they go, well, how can you be conservative and liberal at the same time? You're in the middle of the road. Like, I'm pro-choice, but I'm pro-choice to a certain extent.
Personally, I don't think politics should be a part of it.
I agree.
I don't think it's a liberal or a conservative thing. I mean, it's medicine. It shouldn't have politics or religion involved in it whatsoever.
Do you have a cutoff on, let's say, when a woman should have an abortion and when she should not have an abortion?
That's like I go back and forth on when I think there should be a cutoff. I hate to say that I don't think there should be a cutoff just because that feels...
You can have that. It's your opinion.
It feels brutal to say that, but at the same time, you're like a living, breathing person with like thoughts and feelings and memories and whatever, and it's a fetus. It doesn't, like, you know what I mean? Nobody loves it yet. Like, it doesn't love anyone. It's not really like, that sounds so brutal. God.
But I love that you're having your opinion, because there's going to be people watching this podcast going, oh, hell no. Or,
I know.
I agree with you 100%. But when you say it's not a living, breathing person, no emotion.
No. Not that it's not, but that you are, as in the one carrying it.
All right. What do you say to that?
So just personally, I'm pro-life because I believe that life starts at conception. But that's only my personal opinion. I would never judge anyone for what they do. But I do believe that if someone is going to get an abortion, there should be a cutoff, because I could be off, but the earliest baby to be born and still living is around 21 weeks.
Yeah, 21,
22
weeks.
Yeah, so 21, 22. So if you were going to get one, it should be before 20 weeks, because, I mean, your baby would survive after that.
I was reading one article that said that back in the olden days, before the 1950s, women were allowed to have abortions up until the time they could feel the baby, because then it was considered, because they didn't have ultrasounds back then. So they would say, okay, you're definitely showing you're having fetal movements that you can feel, you can abort. I mean, they were using guidelines that didn't even make sense.
Yeah.
Some of the things. I mean, a lot of people ask me in healthcare, like, how do I feel about abortion? And I agree with both of you. The part that I agree with you about is I don't think the government should be involved in women's health, like a woman's right to choose. They shouldn't be involved at all in medical decisions. I think it should be left to patients and their physicians. And that's the part that this country is going to hell with, because we're allowing politicians to take over healthcare. We're allowing them to decide which vaccine you take. We're allowing them to decide which medication you take. Where do I see this? I see it in my own family, and it pisses me off. Like, my father has Medicare. He can't take a certain drug because it's not Medicare approved. He has to take a less effective drug and show that it didn't work before the other drug. So I'm sitting there saying, so we have to let people die or have a side effect from a medication instead of the one the doctor thinks is efficient for them. So it pisses me off in this country. It also pisses me off that we have 3,000 commercials for drugs and lawyers. I want someone to watch a TV show and tell me you don't see a lawyer or a drug commercial. If you go anywhere else in the world, you don't see that at all. It's against the law to advertise drugs in other countries. Why is it in this country okay? Like, how many commercials do I need to see about male enhancement? Like, how many of those? And how many do I have to watch? I mean, okay, if it ain't getting up with you, you're already seeing the doctor for it. He'll figure it out for you. See, I got off on the topic. But getting back to the whole thing about a woman's right to choose, I agree 100%. I think a woman has a right to choose her own health care and her body. The part that I don't agree with is the time frame. And yes, has my opinion changed over the years? 100%. When I was in residency in New York, I believed that women have a right to choose to abort at any time they want. And then reality kicked in. Because in first year and second year residency, the residents did all the abortions in the abortion clinic. And we did abortions in New York up to 24, 25 weeks then. And it was by definition. Was it 24 completed weeks, which was 25, or was it 24 weeks, which was 23 completed weeks? And I got so confused, I was hoping it wasn't even going to be on my board exam, because I couldn't understand what was 24 completed or was it 23 completed. They were just using numbers. But the only part that bothered me, and I have no problem in like doing abortions back then on patients that had babies with malformations, rape, incest, anything that was abnormal, or they were dying, like they were hemorrhaging and we needed to get the baby out. The part that bothered me were these elective abortions we were doing. And they were like 23 week, 24 week for some of these people. And it didn't still bother me to an extent until I had our first child. And when you see that baby come out and you remember like what you did in training. And the part that bothers me even till this day, and anyone that tells you that they trained in residency and they did it and it doesn't bother them, then they have no soul. But when you reach in to abort a fetus at 24 weeks and it's kicking you in the hand, it sort of screws with your head. So that's where I'm in agreement with some of the countries that say, like, you can't have an abortion, a, quote, elective abortion after 14 weeks. Because I honestly think that after 3 months, 4 months, you know you're pregnant, okay? But I still believe, and I agree with you, that the government shouldn't be involved with a physician-patient decision. If, let's say, we do your 20-week ultrasound, and a lot of times, and in defense of women again, a lot of times they're not getting their OB visits or their anatomy scan till 20, 21 weeks. And we do this and we find a lethal malformation with this baby. The baby's not going to live. There's a chance it can affect the mother. Then I 100% agree with a woman's right and her physician's right to terminate the pregnancy. So I'm in the middle of the road. You see that point?
I have a question for you.
Okay,
so you get your anatomy scan done at like 20 weeks. You see a lethal formation in the baby. You're keeping it? You're carrying to term?
I personally would, yes. Even
what if it could harm you?
Would I die? If
we don't know.
I still would. I don't think I could personally.
That was my question. I'm totally fine with that. Like, again, I am pro-choice. If you want to keep your baby, that is totally fine. Personally, I just wouldn't, which is why.
Well, and that's where we can all agree to disagree, but and the thing I love about listening to both of you, and that's why I wanted you on the podcast today, is that we can agree to understand the reason each person has those views. And I think that's the fucked up thing in this country, is that we don't allow people to have their own independent views. You either got to believe 100% of your view or 100% of your view, and we can't have the middle of the road. And this proves to everyone out there, whatever news station you're watching, that most Americans agree with each other and agree to have independent minds, independent opinions, but also understand where we're both coming from. So, and I think if you look back at history and you look back, like when I just told you about like how abortion first became politicized, it's never the people. Have you noticed that? It's never the people. It's the politicians or some corporate thing that wants to politicize anything, whatever it is. So,
it's like vaccines.
Yeah. I mean, I think, again, I'm in the middle of the road on vaccines. I think vaccines are amazing. They have saved millions of people's lives. I mean, look at the polio vaccine. Look how many people have died of polio, smallpox. I mean, we need vaccines in this country. But I don't need someone standing up at a podium who can't remember what they had for breakfast telling me that I have to have a booster 16 times, okay? I'm in the medical profession. I've seen what's going on, okay? So don't tell me that. Why don't you leave it up to the scientists, leave it up to the medical professionals, and stop looking at the checkbook. So and that's what I think is sad in this country. But it's still the best country in the world to live in. Because I've been to some other ones you don't want to go to. What else can you guys think of?
I don't know. I feel like you expect us to like get on here and fight. We can still do that if you want.
We
could fake
but,
one.
I mean, I agree with anyone else's like choice, and I would never judge them for any choice that they would make.
No, I'm happy. It's not like the Maury Povich shit. That would be cool.
That would be
if I could get a bodyguard like to like pull people apart. You are not the
Maylene
mother of this child. Well, again, thanks everyone for tuning into our podcast. I hope this gave everyone a little bit of an idea about some of the stuff that's going on in regards to abortions and what the rights are. And just remember, even though like some of the stuff is changing politically, women still have the right to choose. Women still can discuss things with their physician, and women can still have elective terminations, medical terminations for necessity. So just keep that in mind and always ask questions. It's your body, it's your life. Thank you guys.